Heather Salas, and this is my abdominal assessment. First thing you would do is come in the room, introduce yourself to the patient, explain what you're going to do, get name and date of birth. Usually you perform it without any clothes on or a cover, but for this video we'll leave him with a shirt on. Very first thing you do would be to inspect the skin. Notice any abnormal coloring like purplish or yellow or red or pale. Second thing to look for would be the vascularity. Any dilated veins would be an abnormal finding. You'd also want to note any striae that you see, because dark bluish striae can be a sign of Cushing's. You would also look for scars or lesions or rashes, things of that nature. You would want to look at the umbilicus. Notice any difference in color. Bluish coloring around it can be Cullen's sign, which is a sign of interabdominal bleeding. You'd also look for any protruding of the belly button, which could be a sign of a hernia. You also would want to look at the contour of the abdomen to see if it's distended or if it's concave. Also, we're going to look for symmetry. An asymmetrical abdomen could be a sign of a mass or something going on. You would have the patient raise their head. Raise your head for me. And notice any bulging, because that can be a sign of a hernia. Thank you. You're also going to watch the patient as they take a deep breath. Take a deep breath. Any diminished, that's good, you don't have to hold it. Any diminished movement can be an abnormal finding. You're going to look at the abdominal aorta to see if you can see any pulsations. You're also going to see if you can see any of the peristaltic wave, which is abnormal on most people, not necessarily abnormal on very thin people. You're going to then auscultate for abdominal sounds. You start in the right lower quadrant and work clockwise, listening for a minute in each quadrant for bowel sounds. For this video, I won't listen for a full minute, but you would listen for a full minute to see if they're hyperactive, hypoactive. If after 5 minutes you don't hear bowel sounds, that's a sign of no bowel sounds, which is abnormal. So starting in the lower right and then working clockwise. Then with the bell of your stethoscope, you're going to listen for listen at the aortic arch for any bruit. You're also going to listen in the renal arteries on both sides, the iliac, and the femoral. Hearing bruit is abnormal in anybody. You're also going to listen for the venous hum in the epigastric region, which is abnormal. And you're going to listen for a friction rub at the liver, which is on the right side, and at the spleen, which is on the left side. Those are all abnormal findings. Then you'll begin to percuss the abdomen, moving from the upper right quadrant clockwise. Anything over organs should be dull. If it's over an organ and it's enlarged area of dullness, that's an abnormal finding. Or if it's not over an organ and it's dull, that's an abnormal finding. You're also going to palpate we'll percuss the height of the liver, starting at the right mid-clavicular line in the right lower quadrant, and working up until you feel dullness. And that's the lower border. And then the top border is from the upper right side of the chest down until you feel dullness. And then you would measure it with a measuring tape too. The spleen begins on the left side, starting the mid-axillary line. And you would percuss till you feel dullness, and then down. Any enlargement of those organs would be considered abnormal. You would also perform blunt percussion to the liver, which is the lower right rib cage, with your left hand striking with your right hand to feel for dullness and to feel around for the dullness. Any pain or enlargement would be abnormal. You would also do it to the kidneys, which I won't do right now because he's laying down, but that's having the patient sit up on the bed and then striking at the vertebral area with your hand down on the ulnar side of your hand. Any pain would be abnormal. Next, you're going to perform palpation. Light palpation with your fingers, noting any tenderness. Doesn't hurt, does it? Okay. And then deep palpation to feel the organs of the abdomen, going 5 to 6 centimeters. Does that hurt? Abnormal would be any extreme tenderness or pain. You're also going to palpate the umbilicus, feeling for any abnormal bulges or swelling or masses. While doing palpation, you'll feel for any unusual masses that should not be there. You're also going to palpate the abdominal aorta using your 2 fingers in this area. In the midline, you should not feel a bounding pulse of the aorta. To palpate the liver, you put your left hand on the patient's back, right hand on the front. You should not be able to palpate it. If you can, it's enlarged, and that's an abnormal finding. To palpate the spleen, the patient would lay on their right side. Here, roll towards me. And you would be able to feel under the ribs on the back. It should not be palpable. If it is, then it's abnormally enlarged. Okay, and we'll roll back. Actually, come back up. Come back up. For the kidneys, just I'm sorry. You're going to put your left hand on the flank, and your right hand in the upper quadrant, just below the costal margin and midclavicular line, and feel for them. They're not usually palpable, so if they are, they're enlarged. And you're also going to palpate the bladder, which is in this area. It's not always, if it's full, it's palpable, but it can also be a sign of a distended bladder. Then you would recover the patient, wash your hands, clean through them. Thank you.